Thank you very much. Good afternoon, everybody. Post-lunch is a hard time to keep people awake. We'll talk all non-clinical, so maybe that is more interesting to you. Something foreign, you might like it better. I can see some familiar faces from Rome as well here. Oh, what happened? So we are presenting to you how some modern day concepts have been used in India to preserve traditional knowledge in healthcare. As you might know, and I heard a couple of speakers before talking about India and Indian traditional knowledge. There's plenty of traditional knowledge in diverse sectors in India, whether it's food or farming or martial arts or medicine. Some of them have been formalized. So we have a term called Ayush. I don't know whether any of you has heard that. Ayush, A-Y-U-S-H, which is Ayurveda, Yoga, Unani, Siddha, and Homeopathy. The 5 streams of traditional medicine in India. A 6th one has been added. It's called Soga Rigpa, which is Tibetan and added in India as well. So these 6, as you can see here in the screen, they are formally recognized. There is formal education available in India. You can do a bachelor's degree, you can do a master's in all these streams of education, in all these streams of healthcare. But there is something called local health practices. India is a huge country, as you might know, almost the size of Europe, perhaps. And there are different regions, different practices in different regions, different kinds of herbs and medicinal plants are grown in different regions. So there are practitioners who use the knowledge of local herbs and they treat patients. They are not doctors. They are not qualified doctors. They are called traditional healers or folk healers. And they, in many cases in India, in a lot of tribal areas and remote areas, they are first port of call for the patients. First thing patients do is to reach out to a traditional healer before they have access to modern medicine or even traditional formal medicine. Yoga, of course, is globally known. There is both formal and informal education available in yoga. So what was done was that there is an ecosystem of standards and certification. We know it word over, it's there for started the manufacturing industry. You have a standard for a product, you certify that product, test that product, and certify that product. This ecosystem has been there all over the world. That ecosystem of manufacturing industry has grown to now you can certify processes like organic or good agricultural practices. You can certify even services like healthcare or training or banking. You can certify also what are called systems, management systems, ISO 9001, I'm sure everybody has heard of. That's typical management systems approach. So one area of certification also is what is called personal certification. You can certify individuals. You and I can be certified for our knowledge and skills. And this is now shifting from a competence, from a qualification-based model. In olden times, we would say, oh, if you have a bachelor's degree, you have 5 years work experience, you have XYZ training, you are competent. No longer. Now we say, we'll define the knowledge and skills that you need. We don't care how you got that knowledge and skills. You got it through education, through informal interaction, through what is called in India, Guru Shishya Parampara, the teacher and pupil tradition that India had. Or by observation. I've been on a construction site for 10 years and I have learned everything about construction. I don't have a degree. I can still be a good construction manager, maybe. So that kind of approach is utilized in personal certification globally. And this is very suited to, in Indian context, very suited to traditional healers because they are largely uneducated. They may be illiterate. They can't do a written examination even. But they'll be able to demonstrate to you. They'll be able to talk to you, tell you what they do, and they'll be able to demonstrate what they do. So this system was very well suited to the Indian context. This is a technical definition, comes from an ISO standards on conformity assessment, which means demonstration that specified requirements are fulfilled. So how do you demonstrate in case of persons? How do they demonstrate that the requirements which are specified are fulfilled? There are varieties of certification. As I said, product certification, you can certify a product, you can certify a process, you can certify a service, you can certify systems, and you can certify individuals. Globally, we talk about welder certification. All over the world, welders are certified. All kinds of professionals are certified, word over. So In India, we have something called yoga certification as well as traditional healer certification. And this uses another expression, which is called accreditation. I mean, sometimes these are getting mixed. These terms are getting mixed, but in our terminology or ISO terminology, I would say accreditation means competence of bodies which actually evaluate, competence of laboratory, competence of inspection agency, competence of certification body. So it's a one level higher. So if you are certified by a personal certification body, I as an accreditation body, and I was chief of accreditation body in India, I would accredit that certification body, which in turn will certify you. So there's a 3 level. Whereas in India also and elsewhere also, healthcare accreditation has come up, which is directly, healthcare accreditation body directly goes to the hospitals. Or education accreditation has come up, where accreditation body goes directly to the education institution. But not in our case, in the ISO definition. As an accreditation body, I don't go to the industry. I go to the certification body. I go to the lab. I go to the inspection agency. They in turn go to the industry and certify or test, etc. So that's one important distinction that you should remember. So we are talking about accreditation, which is about competence, about impartiality. If you are certifying, if you are accrediting, you have to be impartial. You have to be non-discriminatory, impartial, no conflict of interest, etc. And I can assure you it's a huge issue globally. The conflict of interest and is a huge issue all over the place. So this certification, which takes place all over the world to ISO standards. Now, I think she mentioned ISO. I've been in ISO committees, couple of them. Who supervises that system? Somebody has to supervise. ISO doesn't. I mean, many times people confuse, oh, ISO standard, ISO must be authorizing certification bodies. No, ISO doesn't. ISO is just a standard setting body. It sets standards and lets the market use those standards as they wish. But fortunately, there is a system available which is supervising entire certification globally on 2 ISO standards. It's in the form of 2 bodies called International Accreditation Forum, which is an association of accreditation bodies like mine, where I was, NABCB. I was CEO of NABCB, the Indian body, and International Laboratory Accreditation Corporation, which is accreditation bodies for laboratories and inspection. They get together. These 2 bodies, incidentally, are merging now into a single body. Into 2026, we will have global accreditation cooperation as a single body. Now, many countries have single national accreditation body. Especially in Europe, there is a law which says that each country will have a single national accreditation body. But some other countries have multiple accreditation bodies. US, which is, I think, biggest example of free market till recently, has multiple accreditation bodies. Even India has now 4 or 5 accreditation bodies. We used to have only one national accreditation body earlier, but now private sector has stepped in. So there are multiple bodies. And these bodies, there are regional bodies for accreditation. So if I'll show you one picture, which makes it very clear. So here is at the top, the international bodies, which will become one. The IFILEC will become one. It will become Global Accreditation Cooperation. Below that are the regional bodies. Each continent has a regional body officially in existence. For example, European Accreditation Cooperation is in Europe. Asia Pacific Accreditation Cooperation covers Asia and Australia, New Zealand, etc. Inter-American Accreditation Cooperation, which covers both the Americas, North and South America. There is also African Accreditation Cooperation, and there is something called Arab Accreditation Cooperation. Arab countries have got together and created a regional body. And then below that, the individual accreditation bodies. For example, like I come from NABCB, where I was earlier. And below that, the certification bodies, inspection bodies, and labs. And down below is the organization or the product or the service which is being certified. And the interesting thing about the system is, every step there is an evaluation. IFILEC evaluate the regional bodies every 4 years. I have been an IF evaluator myself. The regional bodies evaluate the individual accreditation bodies every 4 years. I have been an evaluator for regional body as well as APAC. The accreditation bodies evaluate the certification bodies, say, annually, almost annually, generally speaking. Could be up to 2 years. So they are being evaluated. And the certification bodies evaluate the process or the product or the service or the person. Now we are talking about personal certification. So as you can see, the entire system has built on evaluation. So we joke in our community that in God we trust, rest all have to show evidence, because otherwise we don't accept. Now the interesting part is, the last part is the most interesting part. Standards against which, say, the person is certified or the product. Let me start with product to make it easy for you. A product, say mobile phone. There is a standard, there's an international standard for the mobile phone. So this is being certified. This is being produced by somebody. It is tested in the lab, which is accredited, or it is certified by a certification body, which is complying to the corresponding standards here. The certification body or the lab is accredited by the accreditation body, which is complying to ISO 17011. The accreditation body is evaluated by, say, APAC or EA here in Europe, and EA is evaluated by IFILAC. So this product can be accepted worldwide because the product standard is common, international, and the method of evaluation is also international because it's following defined international standards. This is the secret of free trade worldwide. If products are moving in Europe from one country to another, this is the basis on which they move. If products are moving from one country to another in ASEAN, this is the basis on which they move. Both sides are taken care of. The product standard is common, and the method of evaluation is also common, whether it's testing, whether it's inspection, whether it's certification. Both are common, and both are evaluated through this system. So this system, although voluntary, figures in free trade agreements, it figures in regulations of various countries. EU especially has designated EA as European Commission has designated European Accreditation Corporation as the nodal body for this kind of work. So now you can imagine if we can standardize internationally, if we can standardize the competence of professionals, then those professionals can be certified under this system and they could move globally. Mobility will be ensured because the standard is common. Now, in case of yoga, because India is the place of birth of yoga, we are hoping that we'll take this standard which we have made to ISO, because now there's a committee in ISO for Ayurveda and yoga. There's a subcommittee. There's a committee on traditional medicine in ISO today. One subcommittee is on Chinese traditional medicine. The other subcommittee is on Ayurveda and yoga. So today, if we create a standard for yoga say yoga instructors, a competence standard, and we take it through our standards body to ISO, and ISO makes a standard with some variation, some changes maybe after consultation globally, that standard would become international standard. And if we use this method, ISO 17024 is for personal certification bodies, then those yoga professionals can be accepted everywhere because they are same competence, assessed in the same manner, same standard. This is the basis. This is the modern day basis which we are using for traditional healers as well as yoga. So now I come to the personal certification. I have already spoken about it, that we are moving from qualification based, degree, work experience, training, to competence based. What is the knowledge and skills? Do you have that knowledge and skills? Let us evaluate that. If you have that, we'll certify you. And this can be done, certification can be done by a variety of methods. You can have an oral interview, you can have a written examination, you can have an observation, actual observation, you can have on-site observation, you can have practical demonstration, depends on the kind of certification you're going to do. As a thumb rule, I would say that if it is knowledge-based, you can test it by written test or interview. But if it's more skill is needed, the more the skill needed, you need a practical demonstration. Can I certify a yoga instructor just by having his knowledge? No, I can't. I have to see whether he knows yogasanas and he can perform those correctly or not. Knowledge is not enough. Skill is needed. So there has to be practical demonstration. I'm telling you just a thumb rule, that more the skill needed, more is need for practical demonstration, more the knowledge needed, you could do with a written test or an examination, oral examination. So this is the international model. This is how internationally there are schemes all over the world, which we are using. There's something called scheme owner. On the regulator side, you know that if there's a regulation, you have a regulator who is the boss. It's a food authority or a drug authority in your country. That's the boss as far as regulation is concerned. On the voluntary side, because it's a voluntary side, there is no law in place. It's called scheme owner. So we have a scheme owner in India. I'll speak about that, Yoga Certification Board. He lays down the standard for certification. What is the competence of yoga instructors? He lays down the process of certification, whether you'll have only interview or you'll have practical demonstration or you'll observe on site, etc., etc. He also lays down what kind of bodies can certify. He doesn't certify directly. He uses independent professional certification bodies who can certify. And those certification bodies are accredited as per ISO 17024 by the accreditation body to bring in the equivalence, international equivalence. So that's how this scheme model operates. So you have to have a standard, you have to have a certification process, and you have to have who are competent to certify. the requirements for the certification bodies. So at this stage, I'll ask my colleague to come in. While she comes in, while the literature that is in front of you says Anil Jauhri and Debjani Roy freelance, but she was responsible for initiating healer certification in India. And she has a doctor in front of her name. I don't. And I was responsible for initiating your certification in India in our past life, that is active service life. So that's how we are here, not just freelancers. Yeah, please.
Yeah. He'll come back again at the end. So we are just interchanging our positions. So thank you very much. By the way, I'm not a doctor, MBBS or anything. I'm a PhD doctor. I'm a biologist by profession. And this certification scheme and the healer certification and all other certifications came as a passion for me. So basically, I was not trained, but somewhere diverted, and this interests me a lot. So therefore, today he has already introduced the system that we are using for the certifications. So I'm going to give you the example how this is being done. I won't get into great depths of it, but I'll just try and generate some interest or some sort of key pointers, how things can be done, even for people who do not have formal education. So traditional healers, actually, they are the first point of contact for very difficult, remote terrains in our country. And this is the healer certification was actually developed for India. And we had a lot of discussion, and healers, we know there are various sort of healers. Here itself, people are working on various mechanism of healing health. So therefore, we had discussion, and the government also agreed that we call the traditional healers of India as traditional community healthcare providers. We don't call them practitioners. Again, there was discussion because they provide the help. They are the first point of reach for any communities. And they are, as I said, available in rural and inhospitable terrains. And that is where they are even rendering very, very important service to maintain the healthcare of our country. And the knowledge of these healers, for lack of recognition or even knowing about them, slowly they were eroding. And that was the point where both of us got together. We thought, okay, there exists an international system for personal certification. Why not try and develop a system for certifying these healers so that they are not only they, but even the families, the next generations are interested to keep continuing with the knowledge and the tradition that they had. So this is how the scenario was developed. I need not go into this because we already know WHO has a very important focus on this, and especially our traditional community healthcare providers are one of those sectors, and therefore, and it also comes under the present UN GDP sector. So therefore, it is very, very important. It has skipped some things. Anyway, some slides are missing, but doesn't matter. I can talk. Few are missing. Anyway, what happened is in order to develop a system for certification, it's an important thing. Even the international requirement is that some few people sit together and think this is what we need, and let us develop a system, let us develop a scheme and try and do the certification. No, it does not work that way. We are needed to develop a pilot. We are supposed to pilot test, and therefore this healer certification scheme was first pilot tested with the support of Government of India. As Anil has said, that was the Ministry of Ayush who gave us funding because they realized the need and the importance of this work. And we worked in 8 districts across India. Some slides are missing, doesn't matter. I can just give you an example. So we decided to choose 8 states across the Indian subcontinent, and they were from various like north, south, east, west, and even tribal districts, which are mostly neglected or they're very remote and people do not come to the main land areas like very hilly northeastern states or even very backward states. And therefore, one of the districts I wanted to just focus on was for the pilot testing. We took this Dang district of Gujarat. We have lot of tribal healers there. And then this was a pilot testing that was being done between the year 2010 and 12. And the applications were sought people. We just went to the communities and told them what is our objective, what do we want to do, what do we want to achieve, and how would they get benefited out of it. Because you have to convince the people. You just can't go and tell, we are trying to do this. They don't get convinced. So you have to be with them. You have to build the confidence with the communities. And therefore, this was one example of Dang district in Gujarat during the pilot testing phase, where we got 70 applications and we had to have a process. That process are all documented. It is on the public domain, out of which 69 were interviewed, and many of them did not have the criteria or the competence, and therefore 55 of them got certified. So in that sense, I do not know, some things have shifted here. I'm sorry for that. But say we did it in Vellore district of Tamil Nadu also, as I said, we worked in 8 states across the country. This was the pilot testing, and we chose mostly the very remote, unreachable areas. But there, here you can see there were 439 applications coming to us, and out of which the scrutiny was done, and therefore they went through the process of assessment or whatever the process was, and then they got certified. And therefore, if I can just put up the pilot testing or the pilot project, which was funded by the government of India, we could certify 517 TCHP, so-called. Across these, we took 6 ultimately, because the 2 areas were either under flood or some sort of natural disaster. So we could reach 6 districts, and therefore we could certify 517 healers. This was a report of 2010-12. Based on this, we realized what are the gaps to be filled. Once you do something, you realize, once you imagine and conceive something in your head, but until and unless you put it in practice, you don't know where are the loopholes. So the gaps that needed to be filled in was the tools for documentation of resources, practices, and customer information, how to approach them. Then certification for recognition of these people. That's a very important component of the scheme. They have to be recognized for their skills. They can be given a certificate, but what after? That is also a very important component. Then skill upgradation. Sometimes we feel they need to have a little bit of skill upgradation because they have gained this knowledge through family tradition or the Guru Shishya Parampara that Anil was mentioning, and therefore some hand holding or some skill upgradation is needed, and then continuously be in touch with them. That also becomes a responsibility of the scheme owner. Therefore, looking at these things, a national scheme was developed by the Quality Council of India and FRLHT, and this was launched in the year 2017 for the nation. And we wanted to do about 10 streams for these traditional healer, of which 6 were developed, and they were now the certification is going on, and therefore they have a proper committee to look into it, proper process to look into it, proper evaluation method to look into it. And till July 2025, 2,866 healers have been certified. And these are the certificates, and the evaluators are also trained to become evaluators. They should also know this. And Then we have done a lot of follow-ups, and we have this story. It is on the website, and all of them, see, most of them in a follow-up story has to be done for, as early in the morning, madam was telling us that, you know, you have to be in touch and do the follow-up, know how they have benefit. And there were many follow-ups done and published also. And therefore, this is a system which was developed based on personal certification.
So I'll take over from here quickly on yoga certification. So you know that it's already a very popular word over, but in 2014, the government of India got in touch with me, in fact, and asked me whether it's possible to certify yoga teachers. I said, yes, we call it personal certification. They said, go ahead, we'll give you a project, develop a system. So in 2015, we developed a system. It was launched we created a small group of yoga experts and people like me who are experts in nothing, but we know what certification is, what standard is, how the process is. So that makes me, do things in climate change as well as in medical devices, as well as in yoga because of that knowledge. And we got a group together. They created a system. And as Debjani said, we ran a pilot and we tested about 10 people through that pilot. And it was launched on first International Yoga Day. That was in 2015, 21st of June, 2015. That was the launch date. And first we started with yoga teacher, then added yoga instructor. Now there are a number of levels, including yoga therapists. Now there's a separate organization called Yoga Certification Board, which was set up in 2018. Earlier it was started by Quality Council of India, where I was. And then it was hived off and taken to another new organization. And these are the levels. These are the various kind of people who are being certified today under the scheme. And this is the numbers you can see. 44,835 yoga professionals as of today. And about 1,400 are outside India. And here are the number of training institutions which have been certified and different categories: leading yoga institution, yoga training center, yoga therapy center. So we have about 109 today, including 9 abroad in other countries. This is the website where you can go and see. So the conclusion is that it is possible to preserve traditional knowledge, especially the one which is not documented very well, and use these modern methods of standard certification, accreditation to bring in a system which can go international. Both the schemes are international. Incidentally, there is also a system for certifying Ayurveda training centers under the Ministry of Ayush, where I am again involved. And at that is certifying Ayurveda training centers globally. So there are a whole lot of systems being built on this modern quality management system to certify traditional knowledge in India. Thank you.